Dr. George Cromack with RenewYourself.net, and I'm here to give you a health tip today talking about strength training. It's imperative that you get some conceptual understanding of strength training. It doesn't mean that you need to be a bodybuilder, but it does mean that you need how to intelligently work the major muscle groups in the minimal amount of time and get the proper rest. If you don't want to end up in a senior health type setup, or you don't want to be walking with a walker or a cane and be dependent on other people, you need some strength. If you don't have strength, you're going to lose your independence and you're going to need help. If you're not doing strength training, you're losing muscle mass. Lean muscle mass burns calories. The more muscle mass you have the rest of the time during the day, whether you're sitting or sleeping, you're burning more calories. You can be several hundred calories extra a day, which can come out to, a couple thousand a week, which is 8,000 a month, which is 2.5, 3 pounds of fat. By the time you're 50, 52, women are starting to go through menopause. Men are going through andropause, which is the male equivalent of that. Hormones are starting to shift. If you're not strength training and you're just being sedentary and going for a few walks, you're shriveling. You're losing muscle mass by the month. There's a lot of other issues with it, but they've shown that senior citizens that strength train can have up to 200 to 300% an increase in strength in as little as 6 months. I work with Dr. Gabriel Cousins, MD, at the Tree of Life, and I see a lot of patients and guests here and the staff, and one of the biggest keys I see missing in the live food movement and in the general population, just go to any airport, take a look around with Walmart. Take a look at the people at Walmart. It's a lot of people with big bellies, guys with starting to get boobs, big love handles, just, not looking good, not looking fit. What I'm really excited about right now is some of the work by Peter Wagner. He holds strength records for men of any age in multiple areas. He's got the world grip strength record. He can pick up 165 pounds with one hand between his fingers. He can bend steel horseshoes with his bare hands. He's leg pressing 2,200 pounds. He did, a couple of years ago, 2,000 dips in a row. Put that in perspective, Jack LaLanne in his prime was able to do 1,000, which is crazy. And he's setting new strength records every month. He hasn't even peaked yet. Okay, what Peter's been working on and what I've been experimenting with myself with really great results is rather than your typical 3 sets of each exercise 3 times a week, we're talking about a lower volume of exercise, maybe once a week with a higher intensity. What Peter has come up with is a formula, and what you need to understand when you exercise, the first level of muscle fibers that get recruited are the slowest twitch muscle fibers. And then when you work a little bit harder, the next level are the fast twitch muscle fibers. And then when you go to a really maximum exertion where you're lifting the weight, you get to fatigue where you can't do another rep, and then you hold it in an isometric contraction until you start to fail. What that does is it recruits the fast twitch glycosidic fibers. When you start doing at that level of intensity, you need to take longer rest periods because there's no way that you're going to recover 2 days later to do another routine. You need about a week, sometimes 10 days to actually fully recover for that muscle to build and become stronger. And we actually start to make better strength gains, and we have to put in less time. So you want to cover exercises that recruit multiple muscle groups. For example, a bench press. And a bench press is going to use your shoulders, your triceps, and your pectoral muscles. And we're going to usually use heavy weights. And so we're warming up, and then we're increasing the weight, doing a couple of reps, increasing the weight a couple of reps, till you get to the point where you can just do one more set, maybe on the 4th or 5th set, where you've worked up to a point where it's the maximum amount of weight you can do, maybe 3 or 4 times. And then you warm down, and you're done, and you give yourself a rest for a week. So we're talking about bench press, bent over dumbbell raises, which are going to recruit a lot of the large back muscles and the biceps. You probably want to get some curls in there, which is going to do the upper arm and the biceps. You want to do chin-ups. What we do with the chin-ups, say you can do 10 reps, you do 7. On the 8th one, you come up and you just hold your head over the bar until you can't hold any longer, and you're going to go to failure basically. We're going to do triceps extensions, which are going to get the back of the arms. And then we're going to do a little bit of abdominal work, and then we're going to try to get the legs. And I really like, especially for people over 50, and rather than doing heavy squats, we're going to do a wall squat where you're going to put your back against the wall, bring your legs, bend your legs till the thighs are parallel with the floor, and you're going to hold that till your legs are shaking and starting to burn. And you start with a minute, and after about a couple of months or less, once a week, you should be able to get up to that 4 to 5 minute range. And that's going to add a tremendous amount of strength to your gluteal muscles and to your quadriceps, large muscles. And boy, you're going to be able to run up hills and just feel great. You're going to feel a lot more secure in your foundation. And the last tip I'm going to give you is when you get done strength training, you need to have some source of protein. We need to make some kind of smoothie. I like using a lot of E3 Live, which is the highest protein food in the world with a high assimilation rate, cuts the recovery time down. So we're talking about a smoothie with E3 Live, maybe a little bit of fruit if you're not diabetic or having a candida problem. You can add a little bit of micronized glutamine powder to that, because glutamine makes up to half your muscles composed of glutamine. We're going to add maybe a little bit of hemp seed powder to that, a little bit of bee pollen, which is going to give you a lot of protein. You can add a little bit of hemp seed oil to that, which is going to give you some of the omega-3s that are really good for you to have. And then we're going to take 5 or 6 capsules of branched chain amino acids. And branched chain amino acids are going to make up about 75-80% of the remaining amount of your muscle that's not made up with the glutamine. And that's going to feed your muscles for repair, and you're going to make much better strength gains if you do that. The other tip I would give you is if you go to my website, you go to the affiliate links, and then you hit the link for Peter Wagner's website. You can get a book called Serious Strength for Seniors and Kids Under the Age of 65. And that's got a lot of great concepts in it about strength training. I talk more about strength training in my book, Renew Yourself, Keys to Rejuvenation and Youthing. It's part of looking good and feeling good. Let's face it, you got to have some muscle on you. Do you ever look at somebody, I mean, they're eating all organic foods, all live foods, and they don't exercise, and they're all skinny and flabby with a lack of muscle tone? Doesn't impress me as being healthy. I mean, it's one thing that is necessary. You can't just do yoga and go for a short walk a couple times a week and expect that you're going to have great muscle tone and be able to operate at a high level of functioning. So that's Dr. George Cromack at RenewYourself.net. That's my tip for today. Cheers, aloha for health.